Good morning, it is Dr. Fern here, and you medicine women are here if you want a life you absolutely love. Now, a question I get commonly asked in a lot of my masterclasses and in general is, what do I do when I have a bitchy nurse? And how do I cope? What do I say to her? What do I do? And this is just my opinion. You have to take the mindset of a leader. What does a leader do? And seek first to understand what is going on in this nurse's head of yours. Why is she the way she is? Why does she have attitude? Does it keep going? And also take a deep breath and think, is there a part of me that plays a part in getting her all weird and bitchy like this and her attitude? Is there some part of me that is to blame as well? Because it is a hard pill to swallow, but often when we can turn towards ourselves and be more introspective about what it is that we're saying that may be causing this behaviour, it is so much more empowering, and then you can actually do something about it. So, is your nurse being bitchy? Does she have attitude? Does she keep on not listening to you, or does she run away and cause havoc? And it may seem like that. So rather than mount an attack, get all communist on her, try and get on top of her and try and pull rank on her, I would say away from the dental environment, take her aside and use some active listening. So just seek first to understand what is going on in her brain, because you never know what it is, why she is the way she is. And what can be super empowering is actually just to sit and listen. And then obviously you don't want to condone the behaviour, you don't want to ignore it, because you will condone it and it will escalate, and every time you think of her you'll lose gut lining. And then also, unfortunately, if you've created the story that you have not resolved with her, then every time you see her you'll always have a veiled intent. Everything that you say, you'll anticipate that she's being defensive and she's being this and that, she's got attitude, so that will come across. So the biggest thing is, she's a human after all, and there is a heart in there. Sit down with her and let her know how you're feeling when I'm feeling this way when this happens, when you don't hand me the composite, I feel this way. Just keep it factual. Don't say that you do this and you do that, because that will just mount an aggressive, defensive response. So treat her as a human, take her aside, speak to her, speak clearly, ask for what you want as well. So use direct communication, and if all else fails, you may need to actually take it. If you're the boss, then you need to mediate this and figure out, is it worth it to have this woman in your clinic losing gut lining? Or if you can't, if you're an associate and you feel that you have no control, you need to talk to your boss. But it comes back to all communication, and I really would urge you to think, what is my part in this? What am I doing to exacerbate this? How can I be better than this? And use this as an opportunity. See her as an opportunity for you to grow. How can I be better? How can I change as a person? How can I communicate better? What is it in me that is causing this reaction? And you can do this not just with nurses, but all your relationships, because after all, relationships are incredible growth points in your life. If you have the courage to take it on the shoulder and not shy away from it, not act defensive, not get all angry over and aggressive, but really turn inwards and be introspective. That's my daily dose of Dr. Fern. If you like what you hear, please share this with all your friends on Facebook. Otherwise, remember to laugh out loud. It is the second best thing you can do with your mouth. Now, go and enjoy relationships.